Thank you all, and I hope you enjoyed the video. So, first of all, it's a pleasure and a privilege for us to be here today and discuss this timely and impactful topic of engaging youth and young people as change agents in SRH, especially in humanitarian settings. So, to give you a short brief about humanitarian settings and youth engagement, out of 8.2 billion people, the world population, 300 million will require humanitarian assistance. Whether it's a natural disaster, conflict, or pandemics, crisis affects health, education, livelihoods in many ways, and it would significantly impact the youth and the young people and also other vulnerable communities. And sexual and reproductive health care will be compromised in humanitarian settings, and the repercussion of this be profound on the young people. So before we discuss youth engagement, it's important to realize that and recognize the realities of the young people during emergencies. So emergencies heighten vulnerabilities of young people, and they often bear the brunt. According to 2019 UNFP study, about 9.7 million people are affected by the young people are affected by crisis, and out of this, about 60% has shared that their expressions are not taken into account in decision making during crisis. The disruption of healthcare results in limited access to contraception, STI, HIV treatment, and maternal care. In many settings, there's also a rise of gender-based violence and unintended pregnancies and unsafe abortions, which all of this would affect the youth during crisis. So for this reason, IPPF has introduced the Come Together strategy for 2028, and in that they have identified youth SRHR as a fundamental component in achieving sustainable development goals, and also for mitigating long and short-term impacts crises in young people's lives. IPPF finds youth engagement and participation as critical to strengthen communities' capacity to prepare for, to respond to, and to contribute in the recovery phase, and to advocate for SRHR in humanitarian settings. So this mini symposium will explore ways in which engaging youth in humanitarian responses is viewed and applied in different types of crises, with the goal of eliciting insights, challenges, and lessons learned that can be applied across governments, multilateral organizations, civil society, community-based organizations, and the private sector in humanitarian settings. So today we have 4 very impactful and insightful youth volunteers who will be sharing their experiences and insight from humanitarian settings. So first, we are joined by Angelica Urot. So Angelica, to tell a little bit about Angelica, she is a youth volunteer from the Family Planning Organization of the Philippines. She is a young volunteer who advocates with FPOP Surigao chapter, where she leads the efforts to raise awareness on key issues such as HIV/AIDS, teenage pregnancy, gender, SRHR, and leadership in stable and humanitarian crises. She has experience in supporting Typhoon Odette response, where she supported the SRHR services and support to affected youth. Next we have Merlinda Jimenez from Indonesia Planned Parenthood Federation. Merlinda is a youth facilitator and a logistician during the SRHR disaster response in Sabu Rijua, Indonesia in 2021. Currently, she is actively engaged with young people in East Nusa Tenggara through the PKBR NTT Youth Forum. With a focus on youth capacity building and community organizing, she is committed to contributing to raising awareness and increasing youth participation in SRHR. Finally, we have Mahalakshmi. Mahalakshmi is a youth volunteer and a branch steering committee member of the Family Planning Association of India. And she's also a member of the South Asian Regional Youth Network, SARIN. She has a master's in social work and she's a Teach of India Fellow, and she has done impactful sessions on comprehensive sexuality education across diverse communities, including persons with disabilities, rural areas, and urban slums. So, welcome to all three of our very important, impactful panelists. So now I would like ask a few questions from Anjali. So how was your experience in contributing to a preparedness plan in emergency?
Okay, so as one of the youth volunteer of the Family Planning Organization of the Philippines, I have had the privilege in contributing to the emergency preparedness plans in various capacities, one of which the Typhoon Odette that happened in the Philippines last December 2021. And this experience is personal to me as I am one of the victim of the typhoon. Our area was directly hit and we were one of the victims of the devastation. So, but still, we are determined to deliver the services. We ensure that women and pregnant individuals still have access to sexual reproductive health services. We distributed safety, hygiene, and maternity kits, and we did discussions and lectures on sexual reproductive health, sexual and gender-based violence, HIV and AIDS, and we also worked closely with the affected youth to address mental health concerns. And I've seen firsthand the importance of timely intervention, especially to the youth and women during crisis.
Thank you, Angelica, for sharing your insight on that. So, can you also give us examples on practical activities of engaging adolescents and young people in SRH and SGBV in preparedness plans?
So one of the activities that we implemented is conducting community-based discussions and advocacy efforts that focus on sexual reproductive health, sexual and gender-based violence, and these activities are tailored to the adolescents and young people to provide them vital, accessible information. And most importantly, we create safe and open spaces for them to share their concerns and experiences because we see this as a very crucial thing because it ensures that we are able to build trust and ensure that these people have the right support during crisis. And on top of that, we also recruit youth volunteers who are passionate in contributing to sexual reproductive health and sexual and gender-based violence preparedness plans. So these volunteers undergo thorough orientation process that prepares them to join our outreach. And during emergencies, these volunteers play a very crucial role in ensuring that sexual reproductive health services are accessible to those who are most vulnerable. And in addition to the outreach, we also we organize youth-led programs where we collaborate with young people, and we make sure that we tailor our activities to their needs and their experiences. And aside from that, we also closely collaborate with the local government to as a key element in our approach. Like together, we implement referral systems to SJBV survivors and to ensure that they have access to medical, legal, and psychological support. Because during emergencies, these are the very important things that we have to give attention to because these survivors, we wanted to create safe spaces for them to be so that they can report incidents, seek help without any fear of stigma or judgment. And this holistic approach that we do with the youth and with the engagement of the youth ensures that no one is left behind. And with young people collaborating and engaging, we are able to create a safer and more supportive environment where everyone is given attention to and given the needs and services that they need during a crisis.
Thank you, Angelica. And it's really important that you highlighted that you should never leave anybody behind. So, going on to the next question, what are the lessons learned that you can share with us about engaging youth and young people, to sensitize them and all of that during preparedness planning?
So one of the important lessons that we learned in engaging young people in the emergency preparedness plan is the importance of youth-friendly communication. Because we know every youth here knows that we respond better to communications that we find effective, that we find engaging, relatable, and that are easy to understand. That's why it is very important, and we really give emphasis on the materials that we create, that it would connect to them, to their cultural and social backgrounds. Because when we tailor our communication to fit their context, we are able to empower young people to understand important topics related to sexual reproductive health and sex and gender based violence. And in addition, we also learned the importance of providing supportive environment for young leaders. And support can come in various ways, may it be for mentorship, access to material, or just simply creating a safe space for them to share their acknowledge their ideas that resonates with their peers, because we know this will lead to a more meaningful conversation on sensitive topics. And another is that we should be responsive and flexible to the changing needs of the adolescents and young people. So issues surrounding sexual reproductive health and sexual and gender-based violence are constantly evolving due to a lot of factors, cultural, social, and environmental factors. So by staying aware of these changes and being willing to adjust our strategies to fit their needs, we can ensure that our efforts remain relevant and effective. And so by applying these principles, we can better engage and inform our young people on our approaches on sexual reproductive health, one that leads to a more successful outcomes.
Thank you, Angelica. So I think these lessons learned that you shared with us would be impactful in our humanitarian programming, especially to engage youth as well. So we will now move on to Melinda. How do you describe the contribution of youth networking in emergency response?
Okay, sure. My friends and I from the IPPA chapters is Nusa Tenggara Youth Forum were directly involved in organizing youth boys and girls in the disasters affected villages. We managed form a youth group of about 15 youth members. We made thematic discussion classes according to the niche of each member in the group. We discussed various topics related to the sexual reproductive health rights and mental health. We utilized the afternoon as a good time for us to conduct our session. After several discussion sessions were conducted, the youth from the aforementioned form youth group actively become youth facilitators who guide the discussion process together with other youth in the group as well as with youth in the disasters affected villages not yet joined in the group.
Thank you very much. So, how would you build trust within the communities during the humanitarian crisis?
To be honest, the disaster location we visited certainly have differences in cultures, language, regions, and habits. For information, Nusa Tenggara is an archipelago province with 21 districts and 1 city. Our province has 72 different local languages in each our district. It takes about 12 hours to travel from the provincial capital to the disaster site. But our one passion is to help our fellow human beings who are in need of our help. Therefore, we approach religious leaders, community leaders, and local governments in the disasters location, building a youth-adult partnership. This was done to get space to socialize ourselves and our aims and objective as young people at the disaster site. Luckily, we got the green light from adults who were religious leaders, community leaders, and local government there. We were introduced to young people there who were willing to accept us and willingly engage in various activities that we designed together. We tried to be their friend without discriminating against them. This was the cause of the young people trust in the disaster location to want to be involved in the organizing that we did and to actively voice their opinions in planning thematic discussion session to evaluating a session that we conducted in the group. They also actively plan thematic discussion activities with other youth in the disaster locations who were not involved in the youth group we formed.
Thank you very much. So that highlighted how challenging it is to build community as youth, to build the community trust during humanitarian crisis. So it's really nice to hear the support that you have received from the community leaders and whom we call adults to engage youth in the humanitarian settings. So now we move on to Mahalakshmi. So can you describe how the youth voices remain central in SRH advocacy and in service delivery in the humanitarian context?
All right. So first of all, namaskar, everyone. A very important question that how youth is centered to SRHR, and when we talk about in context to humanitarian crisis, youth undoubtedly becomes one of the most vulnerable populations when it comes to conflict or when it comes to humanitarian crisis. And when I say vulnerable, I mean young people who are in child labor, young people who belong to LGBTQI plus community, young people who are sex workers, young people who are persons with disability, which are often forgotten. And when including young people in SRHR becoming the center is not only important because they belong to the vulnerable section. It is because they have witnessed those crises, so they have the ideas how to combat from those crises. They have the best solutions to that because they have become the victim of that and they know the reality, the ground reality very much. And additionally, adding to that would be that a young people would be more able to resonate, will be more able to understand, will be more able to understand the challenges and bring out the solutions when it is discussed with their own counterparts, with their people who belong to their people who are young. And because, youth are not monoliths. They have diverse opinions, they have diverse needs. So yeah.
Thank you, Mahalakshmi. So I would like to go back to Melinda for one more question. What are the innovative approaches that you have seen useful in engaging the communities that you serve?
There are interesting things that I want to tell you here because talking about reproductive health, especially discussion related to the anatomy of male and female reproductive organ is still very taboo. We start the discussion process in a fairly careful and simple way by identifying what the physical changes are experienced by a person when he becomes a teenager. After mentioning them, we try to draw them together, and we managed to draw it together. We were able to draw the male and female reproductive organs because we have drawn many times, so it was not a problem for us in the drawing process. They become very happy that they could learn this session, and at the end, they become very proficient to even draw the reproductive organs, mention the part, and explain the functions of each reproductive organs that they drew. Another media that we use and help us during the discussion process is the standing banner. While we pay a lot of attention to the methods that we use when discussing in each session with adolescents in the disaster sites, as much as possible, we did not make the discussion process one way, but we designed a participatory method for each group member so that they also could be active in the discussion process and not become bored with the session we discuss. The participatory method that we use and have mentioned earlier is that we use the game methods. We play while learning. This has proven to make them happy in the discussion process that we make. So they still get the knowledge, but in a fun way. Especially for discussion classes with children under 10 years old, we use puppets, conveying information about preventing child sexual abuse through the storytelling method. One more thing related to the media, we try not to use a lot of brochure or paper made of paper because we don't want the media we use to become additional ways at the disaster site.
Thank you very much, Melinda. So I think it is really important that we use innovative methods to engage youth, because the youth is diverse and they have diverse needs and diverse ways of retaining information. So thank you very much for sharing all the innovative ways that you have used. So let's go back to Mahalakshmi and to ask you the next question. How do you see the role of youth evolving in the future, SRH and humanitarian settings?
Like I previously said, that youth is already the center of SRHR when it comes to humanitarian needs or services. Adding to this point, that youth has always been asking for the seat and has got the seat, but youth needs seat and say. So that is one thing which I personally believe. And when it comes to the evolving needs, what I envision is that youth has the decision making and leadership roles. They have the authority in companionship with already existing norms that are in the society. Of course, we need experience from you guys, of course. So yes, youth needs your support, your learnings from your experiences, but also has to have accountability on ourselves also, and decision making ability, because we often have the habit of doing very creative stuff with the changing needs, with the changing circumstances. Like when we talk about humanitarian crisis, the immediate thought which comes to our mind is the physical effects, food, essential items, and what beyond that? SRHR, yes. Menstrual hygiene management. There is no water. We are talking about menstrual hygiene management. So we have to have that intersection in between also. And along with that, more psychological support. So that is how SRHR has been a very diverse topic. It has broadened its dimensions, like psychological support. What if youth is trained as peer educators, youth is trained as peer counselors? Wouldn't it be more fascinating to have someone like you of your age talking about your needs, what you have felt, without any judgment, without any fear of being judged or being stigmatized? So that is what my idea is. Yeah.
Okay. Thank you very much, Mahalakshmi. And I really like it how you pointed out how having somebody on the field that as a youth you can relate to see somebody who looks like you, who is around your age, supporting you during a time of crisis. So I think that's really important that you pointed that out. So I have one final question to all the panelists. In your ideal world, what does youth inclusive functional preparedness look like?
All right. So preparedness, when we say, I already said that youth needs seat, youth needs say, and youth need learning from your experience. Kudos to your efforts. We need experiences. We need to be equipped. We are more than happy to learn. We are more than happy if you teach us, but treat us as your counterparts only. We need your support and preparedness. Equip us with necessary skills, equip us with trainings as to how to handle, maybe in situations like there are diverse cohort I can see in the back, youth sitting, and who have come here because they have done a lot of ground stuff. They have done so much of field work. They have given menstrual hygiene management trainings. They have been working in comprehensive sexuality education for so long with the community itself. So we need support in terms of what preparedness is, that more skills, more trainings in that manner, and also which are more relevant to the 21st century, which are more relevant to the current times. Like we are like technology wise, digitally, with the changing global scenario, it is more digitally driven. It is more about, especially after pandemic. Pandemic was no less than a disaster, wasn't it? So we are more than happy to collaborate, to have your companionship, and to prepare something which resonates with each one of us and does not makes any distinguish between the adults or the young people. At the last, we all are human beings. We are all fighting for human dignity. We are all fighting for human rights. Yeah.
Thank you, Mahalakshmi. So let me share another question across the panel. What is your vision for the future leadership of youth in SRH in humanitarian settings? How would you envision how the youth would interact in the humanitarian settings in the future?
So my vision for the youth leadership, young people in and adolescents in sexual reproductive health is one where young people are not just mere beneficiaries of the programs, but they are actively shaping policies and initiatives. And I see a future where youth leadership is fully integrated into the decision-making processes at every level, ensuring that sexual reproductive health is responsive to the needs of the adolescents. And by empowering young people and adolescents to take leadership roles, we can ensure or we can create a more inclusive and sustainable future, one that prioritizes equity, education, and accessibility.
Melinda, let's hear from
Okay,
you.
in my opinion, the youth should not be counted as a part of problem, but because of their large numbers, but recognize abilities and qualities and give them space for meaningful participations. This is done from the planning process, implementation to the evaluating process. Adolescents who are well capacitated will be able to produce innovation and creativity that may not have been thought before.
I had similar thoughts, decision making and leadership roles, and adding to that from the community itself, from encouraging peer leadership from the community itself. And just to conclude, it is never about youth if it is without youth. So
Thank you very much. So it's a really good line that you shared with us. It's never with youth without youth. So thank you very much, and it's really such a privilege to have three volunteers who has been actively responding to disasters on the field to share this with us. So we would like to open to questions from the audience now.
My question is to Angelica. So I work in an area where it's a little more like not poverty, but education isn't emphasized for kids and youth. So I was wondering how you were able to kind of get your projects off the ground for SHRA in terms of religion, because I know Philippines is very like Christian country. So I was wondering how you worked around the religious constraints.
Yeah, actually, in advocating for sexual reproductive health, we really face a lot of challenges, and that includes the religion, because Philippines is a religious country. So sometimes parents would think this is actually the thought of parents when we advocate their kids to make informed choices about SRHR, is that we are encouraging their children to have sexual activity. When that's why we wanted to give emphasis that we are not encouraging them to do these acts, but we are promoting safe sex. And then so that they can make informed decisions. And we promote sexual reproductive health while also respecting, of course, legal and religious boundaries. And we just want to give emphasis on the family planning, contraceptive, so that could secure the future of the children, because children, especially the youth, are the most vulnerable when it comes to these issues. So by letting them know that sexual reproductive health will help their children secure their children from any probable unintended pregnancies that can affect their future, that can affect not just their future, their mental health, their holistic well-being. We wanted them to realize the importance of education and awareness for prevention. Like they say, prevention is better than no cure, right? It's the same as like when we go to villages, and then parents would ask us first before they will let their children to listen to our discussions and lectures. Thank you so much.
Thank you. I actually have one for Melinda as well. So you said you used local community leaders to kind of get your message across. How did you do it? Because I would also like to approach my community leaders to allow us to kind of...
Okay, first of all, we try to be approach religious leaders in the disasters affected we visit in the Saburai Jua Island in east of Nusa Tenggara. So the first we gonna to understand their environmental is there. So and we know about the norms or wisdom in there. So we gonna respect for each other in the disasters. And the second, we approach a local government there to socialize our aims and objectives to visit to educational teenagers and adults in the disaster site.
Thank
That's it.
you. Thank you.
Hello, everyone. Firstly, thank you so much. I think it's been a beautiful discussion surrounding involving youth. And my question is, I truly believe that there's a lot of potential in mobilizing youth during the times of crisis. But at the same time, what I feel is most important when you're preparing them to, give that support system to the victims there at the disaster side, I feel is important is to equally equip them with the mental stability and the resilience that is required in order to be able to provide that support. Now, let's say, for example, if you're just a simple act of hearing out the victims, and I know it comes with a huge, a lot of stuffs, because then the victims are directly or indirectly, they're dumping their trauma, right? They're sharing their story, the traumatic stories. So at the same time, the impact that the victim has suffered, then it just shifts back to the volunteer who's at the side providing this. So my question is, it's open to three of you. So my question is, in the acts of mobilizing the youth volunteers to, provide support in the disaster sites, what or how much of emphasis is been provided, or is there anything that the things that are done in order to ensure that at least the youth providing the support, they are provided with the trainings, the the mental stability that's required for them to be able to provide the services that they are going to the ground to provide.
I think it is very important to address that question, because ultimately you yourself get burnt out. So what I can think of top of my head is that sensitizing the youth itself is the very first step which needs to be taken, because we cannot actually push down all the responsibilities. Maybe youth is not cognitively has the capacity to address the crisis, but if we sensitize the youth with proper trainings, with proper debrief sessions, maybe after the whole day, that could be one of the ideas. That how did you feel across the day? Maybe the youth is asking the victim regarding his or her traumas, but at the end of the day, the youth is also a human being, and he or she needs to actually debrief with someone that could, and in that role comes the partnership. In that capacity, it comes the collaboration with the other members. Maybe they can be the hearing, be on the other side, who can actually hear about what were the experiences, because when we share our experiences, it becomes very easy for us to vent out our feelings. So maybe that is one thing.
Okay, so we also really consider that when we are recruiting youth volunteers to for the emergency preparedness, for the emergency for humanitarian response, we really look for volunteers that are passionate in contributing to the sexual reproductive health and for the services, because we really emphasize to them the importance as well of their mental health, because as said that we can really get burnt out. So what we do is, like, during the when we're recruiting the volunteers, we make sure that they undergo intensive orientation process, including training. And most especially, what we do also is, like, one of the activities that we do is role playing, where role playing for the volunteers, what will they do in certain situations, and how are they going to adapt, how are they gonna respond. So that is one thing that we do. Also, when youth volunteers, we also do meetings after the humanitarian response. We do meetings so we can have forums, and our youth corps president would usually initiate that to ask questions for the volunteers volunteers if how are they feeling, if ever they were affected by what they hear from their peers, so that they can make sure that they are in check as well, not just the survivors, but especially the youth, since we are the service provider as well during the emergency responses.
Okay, community collaboration is very important to participate adolescents because when we visit Sabreju Island, we have a peer counselor to help adolescents in the disasters villages, and we learn together. We share about how you're feeling after Seroja typhoon. So it is best solution to participate peer counselor to ask what you're feeling in the disaster set. So
Thank you, Yuval. So I think in the interest of time, we will be closing the session. To look at some key takeaways from the session is that it's really important to have the youth engaged throughout the humanitarian response cycle. So from preparedness to response to recovery, by having the youth engaged and having them as a part of the response cycle is really important to ensure that we are able to respond to the youth needs and also to mobilize them, and it is really comfortable as a youth or as a vulnerable individual to have somebody who you could look at and relate to see somebody who looks like you, who is somebody like you, to support you in the field, especially during a crisis. So it's really important that the three of you from the field shared your experiences with us. So I think this is really important for us to learn from and to incorporate into our humanitarian programming in the future. So thank you very much, Angelica, Melinda, and Mahalakshmi, for sharing your insights with us and also your experiences. And I really hope this will be an insightful experience for you to learn from them as well. So thank you so much, everybody. Thank you to IPPF as well for facilitating this session, and thank you for the audience. Thank you very much.